Good day, everyone. So for this video lecture, we will be talking about microscopic examination of urine. Okay? So I have given your handouts na. Kindly follow through na lang po sa handouts ninyo. Okay? So let's start. Please remind me then to give you this PowerPoint po, ha? Okay. Okay. So, microscopic examination is done to identify soluble substances and formed elements. Okay? So, saan ba nanggagaling primarily yung elements na nakikita natin within your urine? So, primary source niyan is from the blood. Okay? So, from the blood, other sources is from the kidneys, okay, sa genitourinary tract, if there is bleeding, for example, if infection, or kaya naman from external contamination from the outside part ng genital area. Okay, does the presence of formed elements outrightly signify disease conditions? The answer would be no. Okay, so as I have mentioned, di ba, meron tayong pathological causes ng turbidity. So, one of the listed down doon is si RBC, WBC, ganyan. Pero not necessarily if you see a RBC, WBC, or if my presence is pathologic agad or clinically significant agad. So, hindi po. Okay? So, meron tayong mga different factors pa na tinitignan, okay, for us to say na may sakit talaga si patient. Okay? This portion is the least standardized and most time consuming. So how come na least standardized? That's because it is a subjective portion. Okay? So it would depend sa iyo as a medical technology. Siyempre, iba-iba naman tayo ng paningin. Okay? So since ang identification is visual based sa kung anong alam mo at kung anong pagkakita mo, okay? So iba-iba naman tayo ng paningin. And also, for example, binasa mo, tapos binasa ko, hindi ko naman makikita lahat ng fields na exactong kung ano yung nakita mo, yun din yung fields na makikita ko, di ba? Okay? So, syempre, yung elements, yung cells, they move around. Okay? So, hindi yan 100% equally distributed. So, siguro yung part na nabasa mo, maybe marami kunyaring sediments, maraming elements. Yung part na mababasa ko is wala masyado. So, yung reporting natin, in the end, is still different. Okay? So, that's one way. Bakit siya sinabing least standardized? We have what we call macroscopic screening or chemical sieving. So this one is done to maximize time. Okay? So paano pong ginagawa? If your physical and chemical examination is normal, okay, no need to proceed po for the microscopic examination. Okay? Yan. So, however, in special populations, the pregnant women, pediatric, geriatric, diabetic, immunocompromised, and renal patients, or if requested by the physician, regardless of the result ng chemical and physical, is mag-move forward ka pa rin sa microscopic examination. Okay? So, in this part naman, or in the Philippines naman, routinely, hindi po natin ginagawa ang macroscopic screening. Okay? So, routine sa Philippines talaga na mag-move forward sa microscopic lahat. Okay? Yan. Okay. So for this specimen preparation, I think, and I believe you already know this kasi alam ko urinalysis na kayo sa laboratory. So let's just move dun sa mga nandun sa handouts ninyo. Okay, specimen standardization, specimen preparation. Okay, so make sure na properly mix ang sample before nyo i-transfer sa inyong tube. Okay, para equally distributed ang sediments. Preparation of sediment, specimen volume around 10 to 15 ml ang recommended. Okay, when you say 10 to 15 ml, yun yung nasa tube. Okay? So most especially kapag 10 parameters yung inyong ano, ah reagent strip. Kasi kung 5 ml tubes lang gagamitin nyo, hindi yun kasya sa 10 hindi kasya yung 10 parameter strip. Okay? Also, standard na 10 to 15 ml kasi para mas marami kang elements na makuha. Kapag mas konti yung volume ng urine, fewer ang formed elements na makikita mo or makikita mo. Centrifugation. Centrifugation standard is 5 minutes at 400 RCF. Okay, 5 minutes at 400 RCF. Post-centrifuge sediment naman, 0.5 to 1 ml. This is after the decantation, yung ilalagay mo sa sa glass slide. Okay? It's around 0.5 to 1 ml dapat. Okay? Volume of sediment examined. Sorry, mali. Yung 0.5 to 1 ml, that is after the decantation. Pagka-decant mo, yung may iwan sa tube is roughly 0.5 to 1 ml. Sorry. Ang ilalagay po pala sa glass slide is the 20 UL. Okay, 20 UL using 22 by 22 cover slip. Okay? So, sa cover slip po, it is best na gumamit kayo ng cover slip para yung view ninyo is iisa lang. Okay? So, kapag kasi hindi kayo, ang ibig sabihin ko doon, kasi kapag wala kayong cover slip, minsan nagpapatong-patong yung cells. Okay? So, kapag kasi may cover slip ka, okay, so may iwasan yung patong-patong na cells. Parang iisang layer lang yung mga cells. Okay? Mas madali mong mabibilang. Okay? Just make sure lang na malinis yung cover slip ninyo kasi kung hindi, makakahinder lang yun sa vision ninyo. Okay. What else? Examination of sediments. Minimum 10 low power fields and 10 high power fields. Okay, so 10 low, 10 high power fields. In LPO, generally, yung makikita mo dyan, casts and general composition. Okay. Sa high power field is yung identification. Okay. Yan. So, initial focusing mo, use low power muna, and then look for epithelial cell. Okay? So, remember, ang inyong urine, they have low refractive index. Meaning, mahirap silang makita through the kapag mataas yung ilaw ninyo. So, dapat yung inyong light is reduced or as much as possible yung lowest possible setting niya. And then, focus on epithelial cell. Once nakakita ka na ng epithelial cell, you know na nakafocus ka na. Ay, nakafocus na yung microscope. Pag wala kang makitang epithelial cell, baka hindi ka pala nakafocus. Reporting natin dito, casts is average per low power field, RBC/WBC per high power field, epithelial cell crystals in semi-quantitative terms. Example is few, moderate, or many. Okay? And then, ayun. Right. Sa crystals, it is, kapag normal crystal, it should be read at high power field. Kapag abnormal, it's at low power field. Okay, so let's skip this part. Let's go to sediment. For sediment. First, we have Sternheimer-Malvin. Okay. So Sternheimer-Malvin uses crystal violet or safranin O. Ang purpose nito is to stain nucleus or nuclei and cytoplasm. Okay. Next is acetic acid. Acetic acid is for WBC. Okay. Okay. So, ang acetic acid, it lyses your RBCs. Okay. Para ang makikita mo lang or mafocus ka sa WBC. Toluidine blue also for nuclear detail. Lipid stains, we have oil red O and Sudan 3. It's for triglycerides and neutral fats. Gram stain, you know gram stain from your bacti. So it's for identification ng bacterial casts and bacteria. Hansel stain for eosinophils. Prussian blue, it is for hemosiderin granules. Okay. Eosine and then iodine last. Iodine, this is the first stain used for urinary sediments. Okay. So we have different types of microscopy. We have, we can use bright field, which is the most common, yung ginagamit nyo sa lab, that is bright field. The others include, you can also use phase contrast, polarizing, dark field, fluorescence, and interference contrast. So these different types of microscope can enhance the visualization of your sediments. Phase contrast, because low ang refractive index ng inyong mga sediments, this can help sa visualization. Polarizing naman for crystals, yun. Ay, ito pala. Meron pala dito. Phase contrast increases your refractive index. Polarizing microscopy for crystals and lipids, as I have said. Interference contrast microscopy for three-dimensional images. And what else? Okay, review ng microscope. You don't need na yan. So let's proceed with the urinary sediments na talaga. Okay, first we have cellular constituents. We have RBC. Okay. RBC, we can see different shapes ni RBC. Depende po sa type of urine. If your urine is hypertonic, okay, it is crenated or shrunken. If it is hypertonic, it is crenated or shrunken. And then kapag hypotonic naman, it is ghost cells or swollen ang itsura. Okay, ghost cells or swollen. Okay? Kapag naman you have seen RBCs that vary in size, ang tawag natin doon is dysmorphic RBCs. Dysmorphic RBCs. Okay. So this is how your RBC looks like. Kinda looks like yeast. Okay? Well, mukha siyang yeast cell. Okay, how would you differentiate it from yeast? Where's my ayun. How would you differentiate it from yeast? Look for buds. Ang yeast po is parang ganyan, circular din siya, tapos meron siyang mga baby na ganyan, na maliliit na buds. Okay? So si RBC, wala. Okay? Yeah. Oil droplets are differentiated using refractility. Okay? Masyadong, parang medyo opaque, mas opaque po si oil droplets and or air bubbles pag tignan mo under the microscope. Okay? Yan. Ayun. Crenated in hyperstenuric, ghost cells in hypostenuric urine. So this is how your RBC will look like. Okay? So, alam niyo naman yung sura ng RBC. They are biconcave na may central pallor. Okay, kapag po isostenouric yung inyong urine, is ganun din yung itsura niya. Okay? And also, mas maliliit siya kaysa sa WBC and malinis yung loob. Okay? Bilog siya na malinis, walang granules sa loob. Ito yung sinasabi ko parang mas opaque siya kaysa sa air bubbles and oil droplets. Ito kasi dalawang to, pagkakita mo pa lang, ano mo na siya agad, ma-identify mo na agad. And also, malalaki sila kaysa kay, most commonly, mas malalaki sila kaysa kay RBC. Dysmorphic RBC, you can see in glomerular bleeding kapag may during strenuous exercise. Okay? And, the normal value natin again is 3 to 5 per high power field or up to 5 per microliter. Okay? So, increase nito, primarily, it is associated with glomerular bleeding or damage to your glomerular membrane. Okay? Physiologic cause, number one cause is yung strenuous exercise, as we also have mentioned sa chemical examination. Okay? So, yun. Number of cells, extent of damage. So, kung mas maraming RBC, sorry, so mas malaki yung damage kasi mas madaming bleeding. Okay? Macroscopic versus microscopic hematuria, you already know this. Okay, cloudy red urine meaning intact pa si RBC. Kapag clear na red urine is hemoglobinuria. Sorry, I misunderstood this one. Macroscopic versus microscopic hematuria. Okay? Kapag marami ka ng RBC, okay, you can see na magre-red na yung urine. Okay? Kapag clear urine na yellow, okay, it doesn't mean agad na wala kang RBC. Sometimes, kapag konti pa lang yung RBC, like, kunyari, wala pang, hindi pa lumalagpas ng 20 per high power field, makikita nyo siya as yellow pa rin in color. Hindi pa siya nag-red. Okay? Pero still, it is hematuria na rin siya. Okay? So, microscopically, you can see na merong RBC. Hindi pa lang siya nag-color red. Okay? What are the other? Dito. Increased RBCs in urine in your handouts results from damage to glomerular membrane, or yung blank doon is glomerulonephritis. Glomerulonephritis. Letter B, vascular injury in the genitourinary tract, that is bladder stones. Because of bladder stones. Physiologic cause, number one, strenuous exercise. You can see it with hyaline, RBC, cast or granular casts. And then yung contamination is due to menstruation. Okay, so always ask po si female patient if they have menstruation. Next is WBC. WBC, predominant type of WBC is neutrophil. Okay, neutrophil. So that's why sa identification po niya is, remember, bilog siya na maduming loob. That's because of the granules. Okay? So parang may dots siya sa loob. Okay? We can see glitter cells po in hypotonic urine. Okay? Hypotonic urine, that's because of the swelling. Increased WBC in urine, we term it as pyuria. Okay? We term it as pyuria. Increased WBC in urine result from, is it in here? Ayan. Result from cystitis, pyelonephritis, prostatitis, and urethritis. Ito po yung nandun sa blank ninyo. Inflammations because of glomerulonephritis, lupus erythematosus, interstitial nephritis, and tumors. So these are the inflammation. Okay, increased in the next one, the next bullet, increased in eosinophils. You can see in interstitial nephritis and renal transplant rejection. Okay, increased eosinophil in renal transplant rejection. Okay, next one. The next bullet ninyo, okay, greater than 30%, increase in mononuclear cells. Okay, ano yung mononuclear cells mo? That is lymphocyte, monocyte, macrophage, and histiocytes which are rare. Okay, yun yung example ng mononuclear cells. Lymphocytes, monocytes, and macrophage. Okay, it means ay merong chronic inflammation si patient. Chronic inflammation. Okay? And then lastly, lymphocytes. Presence ng lymphocytes is also seen in renal transplant rejection. Also seen in transplant rejection. Okay? So that's what you should remember for WBCs. Ibalik natin yung picture. Ayan. So yun ang itsura ni WBCs. You can also see po, depende sa type ng WBC, makikita mo rin yung kanyang nuclear detail. And tignan mo, yung kanyang cytoplasm, ayan, medyo parang madumi. Because it is granulated. Most commonly, di ba, na predominant type of WBC natin is neutrophil. Okay? So, ayan ang itsura ng WBC natin. Okay. Yan. So, normal values natin dito, ayan, ayun. So, same, 3 to 5 din per high power field or up to 5 less than 5 per microliter. Okay? More in females, naturally more in females. That is because of the contamination from the vaginal tract. Okay? So sa girls out there, if you are familiar with white menstruation na tinatawag or the vaginal discharge, which is which is normal na normal sa mga babae. Yan. So yun yung common na doon nanggagaling yung contamination. Okay? So, yung vaginal discharge, it contains WBC, and then, yun yung usually na sumasama sa urine. That's why, mas maraming WBC ang babae kaysa sa lalaki. Makikita ninyo. And of course, lalong-lalo na kung hindi nyo sinabihan na, again, midstream plain catch. Okay, makikita mo maraming WBC, maraming epithelial cell, minsan may mucus pa. Yan. So, pag ganun, most probably, it's only contamination. Lalo na kung walang symptoms si patient. Yun. And I have a story here, or hindi naman story, pero I want to share something, pero it's for another day na lang. Okay? Kapag sa class na talaga natin, para mas, wala lang. Gusto ko lang. Okay, just remind me. Okay? Next is epithelial cell. Epithelial cell po, we have 3 types. Squamous epithelial is most commonly seen sa male and female urethra, or it comes from the male-female urethra and the vagina, squamous epithelial. Sa transitional, galing siya sa bladder, sa renal pelvis, sa calyces, and sa upper male urethra. So further up the genitourinary tract. And then RTE cell. Okay. RTE cell, depende po sa pinanggalingan niya. Okay. If it comes from the, is it here? Pag nanggaling sa PCT, ang shape niya is columnar. Columnar. If galing sa BCT, shape niya is round or oval. Kapag galing naman sa collecting ducts, it is cuboidal. Cuboidal. Okay. Next is okay. Okay. Dito muna tayo sa PowerPoint. Okay? Squamous epithelial cell, which is this is the largest cell in your urine. Good for focusing microscope. As I have said kanina, kapag nakakita ka ng epithelial cell, nakafocus ka na. Wala kang epithelial cell, baka hindi ka lang nakafocus. Okay? So, yun yung palagi yung hanapin. Okay? Reported as semi-quantitatively or qualitatively rare, few, moderate, many. LPR per high power field per laboratory. Okay, depende sa protocol. This is normal. Okay? Contamination, if not mainstream clean catch. Okay? So, yun. So, this is how your squamous epithelial cell looks like. Okay? Clue cells. Okay? Clue cells are squamous cells with pathologic significance. They it is because of infection with Gardnerella vaginalis. Because of infection of Gardnerella vaginalis. Next is transitional cells or urothelial cells. Okay. So, again, transitional cells, it comes from your bladder or higher up the genitourinary tract before yung inyong tubules. Okay? So, we have different causes po na tumataas or dumadami si transitional epithelial cell. The number one, due to catheterization. Okay? So, because of catheterization, you can see epithelial cell, transitional epithelial cell with normal morphology. Okay? If it is because of malignancy or viral infection, that is because of, you can see pala, abnormal morphology ni transitional epithelial cell. Okay. How would you differentiate it from RTE? Centrally located ang nucleus. Okay. And it has three forms: spherical, caudate, or polyhedral. Okay. So this is how your transitional epithelial cell. Yeah. So centrally located yung kanyang nucleus, and yung kanyang cytoplasm is much more rounder, okay, or consistent kaysa kay squamous epithelial cell na parang mas random yung and mas malapad yung cytoplasm. The next, renal tubular cell. This is the most clinically significant urine. So it indicates renal tubular necrosis. Okay? So saan ba ulit siya nanggaling? From your tubules. Galing sa tubules. So if po siya ay nag-shed, it means there is damage within your tubules. Okay? First, we have PCT cells. PCT cells, again, is columnar in shape. This is larger than other RTEs. It may resemble your cast, coarsely granular cytoplasm, and notice the presence of nucleus, which is in here. May nucleus siya. BCT cells, round or oval in shape and smaller. It may resemble WBC or spherical transitional cells. Observe the eccentrically placed nucleus. The transitional cell is centrally placed. C. DCT or RTE from the DCT cell is eccentric nucleus. And lastly, the collecting duct RTAs, it is cuboidal in shape, never round. Okay? And eccentric din sa nucleus. Kapag 3 or more cells in clump, it's called renal fragment. Okay? So, see, collecting duct RTEs yung nag-perform ng renal fragments. Okay? So, in the Philippines po, or routinely here in the Philippines, depende sa laboratory, pero so far na puntahan kong laboratory, hindi na namin ina-identify if anong type ng RTE. Basta ano lang, RTE cell lang yung nire-report namin in general. Okay? So, clinical significance ng RTE cell. It could be due to secondary effects of glomerular disorders, or it could be due to toxicity. Okay, toxicity from heavy metals, drug toxicity, hemoglobin, myoglobin, okay, which we have mentioned, di ba, sobrang toxic to your kidneys. Hemoglobin, myoglobin, and salicylate poisoning. Salicylate poisoning. Okay. Kapag po may salicylate poisoning, you can see increase in single cuboidal cells. Infections, it could be also because of infections due to viral infections and pyelonephritis. Okay, next is oval fat bodies. Oval fat bodies are RTE cells that have absorbed lipids. Okay, they are free-floating refractile droplets. When you say refractile, okay, so it means na opaque sila when you see it in the microscope. Okay? They have a high refractive index. Multi-cross formation, nakikita mo when using polarized light. Multi-cross is associated with anything lipid. Okay? From cholesterol, sa cholesterol crystal, you can also see multi-cross. Okay? Okay. Oval fat body, you can see it in cases ng lipiduria. When you have lipiduria associated with nephrotic syndrome, acute tubular necrosis, diabetes, and crush syndromes. And, wala na pala dito. Yung next in your handouts, second to the last na blank, that is lipid storage disease. The lipid storage disease causes the presence of large fat-laden histiocytes. And then the last one is bubble cells. Bubble cells are RTE cells containing large non-lipid vacuoles seen in cases of acute tubular necrosis. Yan. Okay? So that's for cellular elements. So let's proceed with miscellaneous constituents. Miscellaneous constituents, number 1, we have spermatozoa. Sorry, I forgot. Sa epithelial cell po pala ang reporting ng squamous and transitional epithelial cell is semi-quantitatively rare, few, moderate, many. Si RTE cell, it is average per high power field. Okay. Next, we have spermatozoa. Spermatozoa, you normally see in urine after sexual intercourse or nocturnal emissions or masturbation. Main clinically significance ito is in testing for male infertility or retrograde ejaculation. Normally po, hindi po natin nire-report si spermatozoa, especially if your patient is female. Okay, kung female si patient, hindi talaga natin nire-report. Pero pag male, it depends po sa protocol ng laboratory. Okay? So, in some laboratory, hindi nila nire-report, and in some naman nire-report. Okay? It depends po sa purpose of your urinalysis. Okay? Kasi if you're detecting for male infertility or retrograde ejaculation, of course, you will need to report yung inyong spermatozoa. So, ano ba yung, alam nyo naman siguro yung infertility, ano yung retrograde ejaculation? Yung retrograde ejaculation po is, you can see it, wala lang akong photo ng anatomy ng males. Okay. So, sa males kasi, unlike female, iisa lang yung daanan, yung tract po ng urethra and from the, what do you call this? Ejaculatory duct. Okay, so isa lang. Unlike sa babae na iba pa yung daanan, hiwala yung urethra sa vaginal tract. Okay, so lalaki kasi isa lang. So yung retrograde ejaculation is when yung kapag nag-ejaculate si male or yun yung si male, instead of going outside, okay, through the going outside ng penis is bumabalik po or papunta siya sa bladder. Wala lang akong picture para mas ma-visualize nyo. Basta instead of going out is pumupunta siya sa bladder. Okay? So pagkapunta niya sa bladder, ang nangyayari kapag nag-urinate si patient, tsaka lumalabas si spermatozoa. Okay? Next we have, sundan natin yung nasa ano ninyo, handouts. Bacteria. Urine is usually sterile. It is contaminated on the way out, and then contaminants multiply fast. Okay? Ayun. So, indicative of lower or upper urinary tract infection when seen with WBCs. If bacteria alone, walang WBC, walang any sign of infection, okay, pero meron kang bacteria, baka contamination lang siya. Okay? It may be due to contamination lang. Okay? It is reported semi-quantitatively din. Okay? So, rare, few, moderate, high. Okay? Most common form is rods or cocci. Okay? Nitrite helps to confirm the presence of rods, but not cocci. Next, yeast. Yeast are single refractile budding structures. Mycelial forms may be present as well. Okay? In diabetic urine, okay, usually seen to sa diabetic patients ha. Okay? Sa diabetic urine kasi increase ang glucose mo, okay? And acid, which is ideal for yeast growth. Seen also in immunocompromised individuals. Okay. If you have presence of yeast without WBC, okay, it means po na contamination only yung yeast ninyo. Okay? So if may yeast and WBC, it means true infection, pero pag walang WBC, ay baka contamination lang. Okay? Parasites. Sorry. This is your yeast pala. Okay, again, kapag mukha siyang RBC, di ba? Just look for the budding structure niya. Where's my... Ayun. Just look for yung buds. Magkakadikit siya. And this one is called, ito yung mycelial form or hyphae na form ng yeast. Okay. Parasites. Most common natin, Trichomonas vaginalis. Parasites are only usually contaminants lang. Hindi talaga siya galing sa inyong urinary tract. Okay? Contaminants lang. Okay? So, we have first letter A, that is Schistosoma hematobium. Okay, it inhabits the vein in the urinary bladder wall, kaya siya sumasama sa inyong urine. Letter B, Trichomonas vaginalis, which is the pear-shaped flagellate, swims across field very rapidly, which is the most usual. Okay? Na parasite. And then Enterobes vermicularis. Okay? You know this sa parasitology ninyo. This one inhabits yung anal area. So it is only a contaminant kapag nakita mo siya sa inyong urine. Okay? So this is how they look like. This is your Schistosoma hematobium, your Trichomonas vaginalis. I have a video later on so you can see. And we have intravenous vermicularis. Or sa face-to-face na lang siguro natin ito ipakita. Okay, so you can identify. Next, lastly, mucus. Mucus is comes from the protein from your RTE cell. Okay, so it comes from your tam horsefall protein. Okay, so yun yung dun po galing si mucus. Okay, it is thread-like, low refractive index. On beginners like you, I think medyo mahihirapan kayong ma-identify ano yung mucus since lalo na ang pangit ng mga microscope natin. Okay? Pero that's how it looks like. Okay? Confused with cast, commonly confused with cast, more frequent in females. Okay? It has no clinical significance. Okay? So, most frequently in females kasi magkamukha po yung mucus from the urinary tract and mucus from vaginal tract. Okay? So, it has no clinical significance. Next is cast. This is okay, cast. Cast are elements unique to the kidneys. They are formed within the lumens of DCT and collecting duct, providing a microscopic view within the nephron. Okay, so what do you call this? In detecting cast, you should remember that low light is essential because your cast has low refractive index. Okay, so always check po if yung inyong light is on the lowest possible setting po. Okay. Composition of cast. Okay, is it in here? Composition is made up of uromodulin. Uromodulin is another name for tam horsefall protein. Okay, so this one is secreted by RTE cells in your DCT and collecting duct. Other components of your cast could be also with albumin and globin. Other components. Okay? Excretion of tam horsefall protein is consistent. Okay? Nag-i-increase lang siya because of stress and exercise. Okay? Okay. Your tam horsefall protein is not detected by reagent strip. Okay? So, again, di ba yung reagent strip nyo, if you remember, albumin lang yung inyong, what do you call this? Albumin lang yung dinedetect ng reagent strip. However, other components, di ba, ng inyong cast could be with albumin and globin. Okay? Albumin yung dinedetect na reagent pad ninyo. That's why if you have cast, most probably you also have positive protein in your reagent pad kasi meron ka ring albumin within the cast mismo. Okay? And also, increased cast, accompanied yan ng proteinuria. Okay? So, magpa-positive ka talaga sa reagent strip. Pero that's not because of the uromodulin or the tam horsefall protein, but it's because of the albumin component. Contributing factors in the formation of cast of tam horsefall protein, urine stasis, pH, and electrolyte. Is it in here? Electrolyte and protein constituents of your urine. Ito pala. Urine stasis, acidic pH, and electrolyte component ng inyong urine. Okay, so how does your cast form? Okay? So ito yung explanation, pero to give you a visualization, mag-drawing tayo. Where's my cursor? Yeah. So imagine this is again, your cast is formed from the density, and collecting duct. Ano bang, ano yun? Anong shape nun? Di ba? Parang ganyan siya. It's a tract. Ganyan. So, itong mga to, ang lining niyan is made up of RTE cell. You have RTE cell. Imagine this is our RTE cell. Si RTE cell, commonly or consistently, nagsesecrete siya ng protein. Okay? If you have urine stasis, okay, magkaroon kang urine stasis, ang mangyayari yung protein na yun, magpo-form siya ng weave-like, parang interweaving uromodulin fibrils. Gagawa siya ng ganyan. Yan, magkakaroon ng ganyan. Yan. So, yan, meron ka ng ganyan, parang nag-form ng something. Tapos magkakaroon ka ngayon ng elements, trapped elements. Kunyari, may bleeding within the tract. Okay, so dadaan si RBC. You have your RBC, RBC, RBC. Okay, dadaan siya dyan. Matatrap siya within the loose network. Okay, so once this, ayan. Yan, so natrap na siya. Okay, so and then after nan, magkakaroon ng detachment. Pag na-detach na yan, naputol siya here, okay, naputol, so meron ka ng RBC cast. Okay, kung WBC yung elements na dumaan, so meron kang WBC cast. And so on. Okay, so ganun po yung simplest explanation po ng pag-form ng cast. Okay? Okay, ayun. Sorry, hindi ako marunong mag-drawing. Pero sana na-visualize. Yun. We have what we call cylindroids. Cylindroids are cast with tapered ends. Okay? So, iniba lang nila yung pangalan with tapered ends instead na rounded ends. Yung normal cast natin is rounded ang ends. Cylindruria, presence of urinary cylindroids in cast. That is cylindruria. You have different types of cast. First, we have hyaline cast. Hyaline cast yung pinakamahirap identify nga. Pinakamahirap makita under the microscope. Because it has lower fractive index, it is colorless. Okay? And it's composed of uromodulin protein. Yeah. So, hyaline cast is the most frequently seen. Normal natin is 0 to 2 per high power field. 0 to 2 per high power field. Okay. Increase yan, physiologic causes lang. Di ba, sinabi natin kanina, nag-increase ang excretion ng tam hormone protein. That's because of stress and exercise. Ganon din sa hyaline cast. Because of stress and exercise, nag-increase the hyaline cast because of fever, heat exposure, and dehydration. So these are cases na nagkakaroon ng urine stasis within your body or within your kidneys. Kaya nag-i-increase si hyaline cast. Pathologic causes, it could be due to glomerulonephritis, pyelonephritis, renal diseases, and congestive heart failure. Ay, nandito pala. Yan. So, in this photo po, letter A is a hyaline cast. Letter B is not a hyaline cast. Okay? Why? Okay? Tingnan nyo po yung parallel sides. Ang hyaline cast po, di ba, it signifies or gives you a visualization ng sides, ay ng tract ninyo, ng tubules ninyo. Itong B, hindi siya definite. See? Okay, hindi definite yung kanyang sides. And hindi rounded ang edge. Open edge siya. Yan. So, this is not cast. Parang nag-clump lang yung amorphous spheroids niya. Okay, ito yung cast natin. Another example of casts. Hyaline cast. Okay. Next, RBC cast. Ang dami ko lang dito. RBC cast. Okay. RBC cast is due to glomerular damage or nephron capillary damage or tubular necrosis. Okay? So, paano na-form yung hyaline cast? Ganun din po si RBC cast. Kaya lang po siya naging RBC cast. Katulad ng example ko kanina, for example, may bleeding, so may RBC na dumadaan within the tubules, matatrap sila, nagkakaroon ka ngayon ng RBC cast. Okay? Glomerular damage seen in conjunction with dysmorphic RBC and increase in protein. Okay. Tubular necrosis seen in conjunction with renal tubular epithelial cell. Okay. Okay. Physiologic cause natin again, strenuous activities, makikita mo ulit si RBC cast. Why? Kasi kapag meron kang strenuous exercise, diba, it triggers the release of RBC and then increase din the hyaline cast. So therefore, possible RBC cast because of strenuous exercise din. Okay. So if there is bleeding within your nephrons, RBC casts are more specific than free RBCs in urine. Why? Kasi nanggaling siya sa tubules. Okay? So kapag po may RBC cast ka, okay, it signifies yung damage is within the tubules and not after. Okay? So katulad nung we talked about sa chemical examination. Okay? Kapag because of renal damage, you can see CAS. Because of urogenital tract problems, you cannot see CAS. Okay? Okay. When hemoglobin is degraded to methemoglobin, you can see dirty brown cast. What's this? Okay, ayan. So, I've mentioned na yung mga yan. Okay. Next, WBC cast. WBC is mostly neutrophil and lobe nucleus and granules are seen with the WBC cast. Okay. Seen in infection or inflammation. Example is pyelonephritis, acute interstitial nephritis. Okay. And glomerulonephritis may be seen in conjunction with RBC cast. Okay. Will there be WBC cast in cases ng UTI? It depends kung saan po ang site ng UTI. Ang urinary tract infection ninyo is on the bladder only, so wala kang cast. If it is higher up on the tubules, so meron kang cast. Okay. Next, number 4, mixed cellular cast. So these are only cast na iba-iba yung laman. Could be WBC, RBC, RTE cell. Okay. So naghalo-halo lang siya sa isang cast. So that's mixed cellular cast. Next, we have bacterial cast. Bacterial cast may be pure bacteria or mixed with WBCs. Okay? I forgot pala. Okay. So, in here, for example, in this photo, medyo mahirap na siyang i-identify, no? One way you can identify po is for looking free-floating WBC. So, ito may free WBC tayo dito. Okay? So, malapit siya dito. So, most probably, this is a WBC cast. Okay? So, kapag nahihirapan kayong identify, you can use that technique. Yeah, moving on, bacterial cast. Okay? So, sorry, medyo mabilis ako kung magsalita. Anyway, you can back naman yung video. Okay, so, parang masyado na kasi mahaba yung video. Okay, number, bacterial cast. Okay, it may be pure bacteria or mixed with WBC. Okay, look for free WBCs and bacteria to help you identify the type of cast. Okay, they resemble granular cast. Confirm with gram staining seen in seen in pyelonephritis. Okay? So, mixed cellular cast is seen in glomerulonephritis, RBC, and WBC. Okay? You can see bacterial cast in urinary tract infections in cases ng pyelonephritis. When you say pyelonephritis kasi, yung infection is up within the tubules na. Okay? So, you can see, possible, you can see bacterial cast. Look for predominant type of neutrophil. Type of cell. It is neutrophil ba, eosinophil ba, lymphocyte. If neutrophil, alam nyo naman yung neutrophil, di ba? Kung para saan. Eosinophil, di ba, for transplant rejection. Lymphocyte also for transplant rejection. So you can know the type of cause wala ng increase ng WBC. Next, epithelial cell cast. This one is formed in DCT. They are small round cells formed due to urine stasis and RTE desquamation. So pag meron kang RTE desquamation, meaning nag-shed yung RTE cells mo, yung lining ng tubules mo, it means you have damage within your tubules. Okay? Fibrils forming cast pull cells from damaged tubules. Nahihila sila kasi marupok na sila. Okay? Because merong damage. Okay? Seen in the following conditions: tubular damage, heavy metals, viral infections, drug toxicity, graft rejection, hepatitis, and glomerulonephritis. Next, we have fatty cast. Fatty cast seen with oval fat bodies, seen in nephrotic syndrome and diabetes. Okay, seen in nephrotic syndrome and diabetes, they are highly refractile. Okay, and oval fat bodies may attach to the matrix. Seen in nephrotic syndrome, diabetes, and carcinoma, same with your oval fat body, doon din natin makikita si fatty cast. Granular cast. Okay. Granular cast may be coarse or fine. How? Okay? So, saan po nanggagaling sa granular cast? Yung granular cast ninyo nanggagaling po sa lahat po ng type ng cast. Pwede maging granular cast. Ganito po kasi yung buhay ng inyong cast. Nag-start siya sa hyaline cast. Okay? If in cases na merong cells within the dumaan sa tubule, so matatap sila, magiging cellular cast na siya. When I mean by cellular, it could be RBC cast, it could be WBC cast, it could be epithelial cell cast. Okay, cellular cast yung mga yun. Yung cellular cast, further urine stasis, nagsa-start na mag-degrade yung inyong mga cells. Okay, it becomes coarse granular. Hindi mo na siya ma-identify kasi nagsa-start na siya mag-degrade. Coarse siya kasi you can still see a few parts or a few distinction. After ng coarse, pupunta siya ng fine. When you say fine, totally parang na-degrade na talaga yung mga cells, hindi mo na makita, parang dots na lang sila. And then lastly is kapag fully, parang kumbaga, parang natunaw na yung cells, parang siya nagiging waxy cast na. Kasi yung waxy, it is clear on the inside na. Okay, so ito po yung buhay ng cells niyo talaga. Okay, so your granular cast may be either coarse or fine. Okay? Granule origin can be because of RTE lysosomes excreted in normal metabolism. Okay? This causes disintegration of cellular casts and free cells. Significance niya physiologically, you can also see this in stress and strenuous activity. Okay, at a certain level, it's still possible na normal siya. Okay, because of stress or strenuous exercises. Okay, and also seen in glomerulonephritis, pyelonephritis, other conditions with urine stasis. Okay, waxy cast. Okay, let's move on sa waxy cast. Ayan po ang itsura ng waxy cast. It is brittle, highly refractile, often fragmented with jagged ends. Okay, so hindi mo siya mako-confuse with hyaline cast even though yung laman nila parehas parang smooth lang sa loob. Kasi this one is highly refractile. Okay? Degenerated hyaline and granular cast due to extreme urine stasis indicating renal failure. Hanggang granular cast lang po ang normal because of strenuous exercise. Waxy cast po, makikita mo lang to sa in cases of renal failure. Okay? Other associated conditions, amyloidosis, advanced nephritis. Okay, question. Can waxy cast be seen without any other type of cast? The answer is no. Okay? No, that is because waxy cast, again, yung end stage ng inyong mga cast. Okay? So, hindi ka pwedeng magkaroon ng waxy cast lang na wala kang ibang other types of cast. Kasi, hindi naman agad-agad nagiging waxy yung mga cast ninyo. Matagal pa yung buhay nila. Okay, so it's impossible na lahat ng cast within the urine sample na meron ka is puro waxy lang. Okay? We have what we call broadcast. Broadcast, also known as renal failure cast. So all types of cast, most commonly granular or waxy, okay, they can be broadcast. Kaya lang siya nagiging broad because of the destruction and widening of your DCP. Okay? So kung kanina, yung space between, space natin ng, yung space natin is like that. So ito lang yung DCT nyo na track. okay, or na tubule pala, lumalapad na siya. Kaya siya nagkakaroon ng broadcast. Okay, di ba? Again, yung cast, it gives you a visualization of your tubules. Okay, so itsura ng tubules ninyo. So broadcast, so yung lumapad na yung inyong tubules. Okay? So also known as renal failure cast, this indicates grave prognosis. When you say when you see a broadcast, it means yung talagang, yung kidneys niya is talagang sirang-sira na. Okay? So, talagang wala na siyang pag-asa. Okay? Okay. Yun. For the, okay. So for the urinary crystals, I will be giving this to you as a reading assignment na lang po. Anyway, and if lahat naman ng details that you will need is indicated in your handouts. Aside from it being a reading reading assignment, okay, meron po dyan na blanks, yung appearance, and another is yung description. Okay, so that's an assignment po for you. Okay, ang gagawin nyo lang po is, using the space provided, kung ano lang po yung nasa handouts ninyo, doon lang po kayo magdodrawing. Paki-drawing po yung crystal na hinihingi, and also give the description specific or specific for that crystal. Okay? Yun. So, if you're gonna ask me kung pwede po sa ibang papers, wag na po kasi that is more of a reviewer than an assignment. Okay? So, para po magagamit nyo pa rin yan, andyan na yung details na kailangan ninyo sa crystal, and also may visual din kayo, may picture din kayo. Okay? So, kahit po simple lang, tanggapin ko, okay, as long as it is correct, yung itsura niya, and yung description is also correct and specific for that crystal. Okay? Yeah. So if you have any other questions po, feel free to message me, okay, for clarifications like so. Okay. And then thank you for listening po, everyone, and have a nice day.